Lots of patients ask me what's the difference between dry needling and acupuncture. Dry needlers and acupuncturists are kind of like, having a toolbox with like a spanner in it, and that's all you've got. And a toolbox where you've got a hammer, you've got a spanner, you've got a screwdriver set, you've got an electric drill, you've got, whatever, you've got everything in there. Like you've got this U-Butte toolbox. You don't necessarily use all those tools all the time, but if you need that tool, it's there when you need it. Whereas with dry needling, you've just got the spanner, that's all you can use. Now, not every condition needs a spanner, but if that's all you've got, all you can use is that spanner. So yeah, that's the difference there. So a true Chinese medicine model is like, you're a person who happens to have plantar fasciitis, but what else is wrong with you? What else is out of balance about you? How's your emotions? How's your sleep? How's your general health? And we would know that through asking you questions, checking your pulse. The main way is through the pulse. So let's say the patient does have the plantar fasciitis and they say, yeah, okay, ask them all the questions about that. You know what you're going to do, in terms of an acupuncture treatment for that. And then you check the pulse and you say, well, you feel that there's something in there that's telling you they don't have good sleep. They might not have good sleep. So you ask them about, oh no, I don't have very good sleep. How did you know that? And so then that forms some more questioning that you would ask. And so that's a much more holistic approach, because if that person doesn't have good sleep, how are they going to make good quality blood to heal their body? I don't know. What about their diet? What if they don't have a good diet? How are they going to manufacture the products that they need to heal themselves? Or they've got some obstruction in their bowels, and you feel that they've got something there in their pulse, and you ask them about their bowels and they're like, oh yeah, I do have constipation, I go every 4 days, and they think that's normal. So that's where Chinese medicine is a bit different to just pure dry needling. So in a musculoskeletal sense, the actual needling for that individual area might be very similar. And certainly acupuncturists can use techniques of dry needling should they choose to do that, but they have just a lot more tools in their toolbox. It's so you don't use every tool for every job. You might not really use a sander for every job, but if you need a sander, you've got one there. If you need a power drill, you've got one there. If you need some putty to put in a hole, you've got some there. You've got all these different tools, and should you need to use them, you can use them. Whereas if you just both have got the spanner, both have got the tool of dry needling, both can do that skill, but that's all you've got. Now, when you talk about musculoskeletal issues, sometimes the treatments might be very similar to both the dry needling and acupuncture. So that local approach of pinpointing where trigger points are and needling those points, or needling into the with a knowledge of muscles, and actually just thinking, okay, we need to unlock this muscle, or get that twitch response from that muscle. And that can sometimes be used by acupuncturists to do particular things for musculoskeletal things. But if a patient comes in and has both musculoskeletal things and internal medicine problems, in Chinese medicine we'll call that, so they have constipation, or they had headaches, or they had a sore throat and they had a cold or a flu, or they had other stuff like that, well, Chinese medicine the system of Chinese medicine can encompass treatments for that, whereas dry needling cannot. So you're not really getting a holistic approach for that. And so what that means at the end of the day is patients then have to spend more money to go to different practitioners to have different treatments. So they have to go and, let's say you had a cold or a flu and you had the plantar fasciitis problem, which is like a foot pain problem, you could go to an acupuncturist and they may be able to give you a treatment that can encompass both of those things. Whereas if you go to a dry needler, that's all they can do, is only those musculoskeletal things. So then you either just put up with the cold or a flu, and you don't get that resolved properly, or you have to go then to the chemist and get more medication, or you have to go and see your herbalist individually, separately for that. And so that's the difference in Chinese medicine, to Chinese medicine based therapies, which is a Chinese medicine practitioner who does acupuncture and a person who just does dry needling, or even someone who does acupuncture but they're not a Chinese medicine practitioner. They're a physiotherapist that does acupuncture, or they're there's people now that would say they do acupuncture but they don't care about the framework of Chinese medicine. So if they're not checking your pulse, that's one thing that you could think of, then they're probably not doing real Chinese medicine. And I would say it's not really acupuncture if they're not checking your pulse and they're not doing it in accordance with that way, because that's what Chinese medicine, that's the hallmark of Chinese medicine, and that's the way that we get the most accurate and the most in-depth information about your body.